Hello friends, I am Dr. Ashish Chauhan, consultant diabetologist, Apollo Hospitals. Do you have a diabetes? Okay, well controlled, good news. Are you concerned about complications of diabetes? My answer is, if you are not, then you should be. Make sure that you know the complications of diabetes so that those complications can be prevented. There's a huge list and I will try to help you out with all of them as early and faster as possible. The two main complications of diabetes are acute complications and chronic complications. Acute until it comes very fast. Diabetic coma. You can be having a diabetic coma with form of low sugars or high sugars. It can be hypoglycemic coma, or it can be DKA or diabetic ketoacidosis, or HONC, which is hyperosmolar non-ketotic coma. Two big words. Extremes of sugars can cause you to have a coma stage. Make sure your sugars are not falling less than 70 or not crossing 300 or 200, where you will reach into the coma stage. These are the acute complications. What are the chronic complications of diabetes? Chronic means long-standing complications. The long-standing complications of diabetes we divide into microvascular and macrovascular complications. Microvascular means you have issues with kidney, you have issues with eyes, and you have issues with nerves of the legs, that is neuropathy, nephropathy and retinopathy. The macrovascular complications, you know what it causes? It causes the heart attack, it causes the paralysis or CVA, it causes the peripheral artery disease, where 85% of non-traumatic amputation is because of the diabetes. So these are the microvascular and macrovascular complications. You can be having those complications. That's why whenever your doctor asks you to do the blood test or any test, do it. Do not question your doctor. Your doctor does all his efforts puts together to keep you and your family out of hospital, out of ICU, and it cannot be done if we do not do the investigations. Finally, we have complications like that of infective complications. Any infection in diabetes is kind of 5 to 10 to 20 times or 100 times more dangerous and more common. What are the common infections you can have? Is lung infections like influenza or pneumococcal disease, and both can be prevented by the right vaccination. Besides the lung complications or the infections, you can have urinary tract infection. You can even have the brain infections. You can have the abdominal infections. What are the scary infections? Do you know? There's something called as rhinocerebral mucormycosis. There is something called as ear involvement, malignant otitis externa. There can be your gallbladder involvement like emphysematous cholecystitis or emphysematous pyelonephritis, where removing the kidney is the only chance you have it to save yourself. Why am I telling you about these complications? If you have uncontrolled diabetes, probably you are at fault. But if you have complications, probably there is an improper communication between you and your doctor. Reach out to your doctor before it is too late. Because yes, once you are a diabetic, we cannot make you non-diabetic. Be careful, because a lot of people and a lot of different people say that we can reverse your diabetes. I don't think that's possible. But definitely what you and me can do it is, we can prevent complications. How do we do that? By doing the proper investigations, by taking those medicines which you need to prevent those complications, and assuring that we are staying happy, healthy and smiling wherever we are. Stress causes high sugars, high blood pressure, as well as heart attack and paralysis. So stay away from stress, stay away from smoking, stay away from sedentary lifestyle. Let's take a walk the way I'm going to take a walk right now. Let's take stairs always. Do not take the lift. And these things will make you that you do not get the complications of diabetes. If you have any other doubt, I am Dr. Ashish Chauhan, available at 810-612-7475. Anytime on WhatsApp. I'll be there to help you out so that you and me and the whole family of ours stay healthy, happy and smiling and out of hospital. Don't forget to press the bell icon and subscribe to our channel. Take care, God bless, Allah Hafiz, Namaskar.